Whenever you read or hear the clinical term meningoencephalitis, okay, this is an infection slash inflammation of both the meninges and the brain, to a lesser extent, the spinal column. When you hear meningoencephalitis, just for all intents and purposes, just go ahead and figure that it is caused by a stupid chihuahua who won't shut the hell up, or two types of amoeba, Naegleria fowleri and acanthamoeba. These are our two chief causative agents. These are two parasites, and yes, they are parasites, that will invade the body, and preferentially they will travel to the meninges and then gain access to the brain. Most people at some point in time have gone swimming in a lake, a stream, a pond. You've been exposed to Naegleria fowleri. What we see has happened is that you get a bit of water from the lake, the river, the stream, some fresh water body, whatever it is you're swimming in. You get the water up your nose. In that, that water is the amoeba Naegleria fowleri. Naegleria fowleri will attach to the sinus nerves, the olfactory nerves of your sinus, and they will literally climb up them, swim up them, migrating towards the brain, because literally the olfactory nerves in your nose are directly connected to your brain. Once the amoeba swims up those nerves and gains access to your brain, we find that they cause what is referred to as PAM, primary amoebic meningoencephalitis. The presence of the amoeba in the brain will lead to destruction of the brain tissues. Just think about it. Your neurons are going to be surrounded, enveloped by different cells, Schwann cells, glial cells. Schwann cells are high fat content cells that are acting as insulators between the neurons so you don't get cross signaling during depolarization. Well, all that fat is an excellent nutrient source. So the amoeba start going through and spitting out digestive enzymes, which causes the Schwann cells, the glial cells, to all burst. We find Naegleria fowleri in pretty much all bodies of water, all freshwater bodies. It's there, it's everywhere. If you've ever been swimming, you've been exposed. Okay? Small children, up to teenage years-ish, who go swimming a lot. Yeah, we can isolate Naegleria fowleri from their bodies, from their sinuses. Passes through their gastrointestinal tract. It's a transient. Turns out that the infections patients developing PAM is actually quite rare when you compare it to the number of people that are exposed, that number of people who pick up a transient infection or colonization, I guess would be a better term. When it comes to treatment, well, here's the problem. Generally, the only way you know that you have PAM is when a patient begins to present the signs and symptoms of brain damage. Now, once somebody presents in a clinical setting in the ER with loss of motor control, loss of mental acuity, they're starting to go blind in one eye, things like that. And they tell you a few days ago they were on a trip, they were swimming, and you think, oh my gosh, it's PAM. Yes, you can go and you can start treating with amphotericin B, sulfadiazone, tetracycline, and others. Try to get rid of the vegetative cells of Naegleria fowleri. It's going to have to be high dose over quite a few days because, like most amoeba, Naegleria can sit there and form a cyst when it's under pressure from chemicals or changes of salinity, things like that. So you have to treat, retreat, retreat, retreat. But here's the thing. Once the brain damage is done, there's no going back. Okay, there's no healing. The pathways that are lost are lost. Few patients, they can reform new pathways, relearn how to tie their shoes, relearn how to talk, walk, feed themselves. But the majority of patients, once they actually make it to the ER, are irreparably brain damaged, and there is an extremely high mortality rate. Acanthamoeba is going to cause what is known as GAM, granulomatous amoebic meningoencephalitis. Difference PAM, GAM, how quickly is onset of symptoms. Naegleria, it's going to be a fast, acute onset. Acanthamoeba, it's going to be a longer duration, slower accumulation of the damage. Naegleria swims up the sinuses, the olfactory nerves. GAM generally enters into via broken skin, in through the eyes, the lungs. If you accidentally breathe in some water and choke a bit. It's also been shown to go and enter in the urogenitals, the urethra, the vagina. Gets into the bloodstream, settles out in the meninges, and will slowly over time break down the meninges in certain areas and then gain access to the brain. Remember, the brain is basically just one giant, as far as these things are concerned, it's just one giant fat globule just waiting to be eaten. Whether it's PAM or GAM, once symptoms are present, the symptoms you're going to find are generally the accumulation of brain damage, and if the patient survives, what was lost is pretty much not going to be able to be regained. There's also going to be a high mortality rate.